Hi, everyone. I want to talk about something deeply personal and deeply scary, being alone when a health crisis hits. Maybe you live alone, maybe your partner's just out running errands, but in that moment of crushing pain, you feel utterly isolated. I've heard so many stories. Patients who survived told me their first feeling wasn't the pain, it was shame. Shame that they might be bothering someone. Shame that it might just be gas. This hesitation, this internal debate, is what kills. That silence, that feeling of, I'm alone, I can handle this, is a lie your survival instinct tells you. But I'm here to tell you that you are not helpless. You have power. You have a chance to rewrite that story. And it starts with a few simple, powerful acts of self-care in the face of terror. Let's walk through the three most vital things you can do in those first terrifying minutes. 3. The mental shield, lowering the workload. Your immediate internal enemy is adrenaline. When you panic, your body floods with it, forcing your struggling heart to beat faster. It's a vicious cycle. So your first survival job is to become a master of your breath. Slow, intentional breathing. Find a supportive position. Sit upright, back supported, feet on the floor. Now practice this with me. Inhale slowly through the nose, counting to 4. Exhale slowly through pursed lips, counting to 6. This isn't just about oxygen. It's about sending a calming signal to your brain. It says, I am in charge of this moment. It's your mental shield, reducing the strain on the muscle that needs it most. 2. The chemical pause button. Once you've anchored your breath, you need to call in the cavalry. But while you wait, there's a powerful helper on your side, aspirin. If you're not allergic, immediately chew. Don't swallow. One full 325 milligram aspirin. Chewing is key. It gets the medicine into your bloodstream faster to fight the clot. Think of that aspirin as a tiny pause button. It doesn't stop the attack, but it slows the clotting process, buying those paramedics the critical minutes they need to reach you before massive damage occurs. It's a non-negotiable step in your survival strategy. The call and the stillness. This is the big one. Call 911 immediately. Do not wait. But here's the crucial twin step. Once you call, stay absolutely, completely still. If you're sitting, stay sitting. Do not try to walk to the door, walk to a window, or walk to the kitchen. Movement demands oxygen. And during a heart attack, your heart is being starved. Every step you take is a taxing demand that can trigger a catastrophic event. Place your phone on speaker, tell the dispatcher where you are, and then practice your slow breathing. Unlock your door if you can reach it safely, and then become as still as a statue. Your stillness saves heart muscle. You've done the 3 life-saving steps. You've called 911, you've taken the aspirin, and you are breathing slowly while sitting still. Your job is not over. It's changed. You are now in a holding pattern. While the paramedics are en route, you must maintain communication. Keep the dispatcher on speaker. They are trained to keep you focused and calm. They will ask you simple questions like, are you still sitting? Or what color is your door? Answering these questions keeps your mind engaged and prevents you from slipping into total panic. If you are near a door or window and you have the strength, signal your presence. Maybe tap the window or just move your hand slightly so emergency services can spot you when they arrive. Do not stand up to do this. And here is a practical tip most people miss. Take off any middle jewelry that feels tight. Rings, watches, tight bracelets. As your body's circulation changes and swelling may occur, these items can become constricting and cause problems later in the hospital. This small action gives you a feeling of control in a moment when you have none.
You are not powerless. You are prepared. Knowing these 3 core steps, breathe, chew, and be still, plus the crucial holding pattern and what not to do, gives you a comprehensive script to follow when your mind is panicking. It transforms fear into action. Now, go review where you keep your emergency aspirin. That's your homework. And before you go, tell me in the comments if you needed to. Is your front door currently set up so help could get to you quickly? Let's start a discussion about preparation.